Hey everybody, Karen Anderson here with Aortic Hope for today's Week in Review. If you're not familiar with what the Week in Review is, this is when we review all of the posts we put up last week and we give you a chance to share your thoughts, your opinions, questions, ideas, whatever it is you'd like to share. You can share in the comments below. Just remember, public page is going to stay out here forever, so be kind with your comments. But before we get started, please click like. Please click the subscribe button so that you're notified every time we go live. We have so many great things happening this month of March, and you just don't want to miss any of it. So if you click that bell, you're going to get a notification, and then you'll be like, oh, that's right, they're going live. They have this happening, and you won't forget it. And then when we're done, I'm going to ask you to click share because somebody will get something out of today's Week in Review. It is just wow. I can't even believe it's already March. I thought 100% we sprung forward this weekend and sat in my house and looked at the clocks and looked at my watch. And I couldn't understand how my watch had already sprung forward. And I was like, that doesn't make sense. If we set everything and my watch just did it on its own. And my head hurt so bad for so long trying to figure out how it sprung on its own, knowing that it couldn't, but thinking that it did. And then I finally Googled it and realized, yeah, that doesn't happen till this weekend. So I've changed some of the clocks in my house like week in advance. So I'm already adjusted and we're not there yet. So there you go. All right, let's get started with its Medical Monday post. Medical Monday post. So in honor of Black History Month, which we just came out of from February, and we just came out of Heart Month, and we just came out of heart valve disease awareness and women's health, came out of a lot. But in honor of it having been Black History Month, we wanted to celebrate the amazing contributions of pioneering African American physicians who made a profound and palpable impact on the field of cardiac surgery. So let's talk about a couple of them. Let's start off with Dr. Daniel Hale Williams. He is considered the heart surgery maverick. He was actually born in 1856 and was one of the first African American surgeons in the United States. He founded Providence Hospital in Chicago in 1891, the first Black owned and operated hospital in the U.S., and it was to provide critical medical care to African Americans who were denied treatment due to cruel discrimination. In 1893, Dr. Williams performed the first successful open heart surgery without the luxury of anesthesia and antibiotics for someone named James Cornish. Poor Cornish, right? No, no. I had to read that 3 times. No anesthesia. So Cornish ultimately suffered a very severe stab wound. Well, this is what precipitated this to the heart, which was a certain death sentence during this time. However, with Dr. Williams' improved techniques, Cornish actually survived and fully recovered. I would have died from the pain. I'm just pointing that part out, that it does say without anesthesia. One more time to make sure we're all clear. Dr. Williams' pioneering work not only made immense strides in providing healthcare to African Americans, but also opened the world's eyes to the possibility of open heart surgery. It's an incredible story. All right, we're going to jump, I guess, forward in time, right, to Dr. Vivian Thomas, the unsung hero behind pediatric cardiac surgery. So Thomas was born in 1910 and aspired to become a doctor, but he had to withdraw from college due to financial hardships. He instead became a laboratory assistant for the prolific pediatric heart surgeon, Dr. Alfred Blaylock at Johns Hopkins University. And there, Thomas played a critical role in devising and planning an innovative operation for tetralogy of Fallot. It's a congenital heart defect that made it difficult for infants to breathe. Actually, never heard of that. Thomas devised this shunt that would bypass the narrowed pulmonary artery and deliver blood to the lungs to improve the infant's breathing. However, due to his lack of medical credentials and discrimination against Black healthcare professionals, he was not credited with this shunt, and it was instead called the Blaylock-Taussig shunt. His contributions were later recognized, and he received an honorary degree, doctorate from Johns Hopkins University. And Dr. Thomas's pioneering procedure not only saved numerous lives, but also revolutionized the field of pediatric cardiac surgery for years to come. It's amazing how these things happen. Now, I've heard of this doctor many times, Dr. Rosalind Scott, breaking the glass ceiling in cardiothoracic surgery. So Dr. Scott not only broke barriers for Black physicians in the field of thoracic surgery, but also broke the glass ceiling as the first African American woman to train in thoracic surgery in the US. In a male dominated field, Dr. Scott pioneered advancements in lung transplantation and minimally invasive procedures for lung diseases. Furthermore, she became a champion for diversity in medicine by mentoring numerous physicians and trained generations of incredibly talented thoracic surgeons. Let's talk about undenying legacy. So, from Dr. Williams performing the very first open heart surgery to Dr. Thomas pioneering a life saving procedure for infants with tetralogy of Fallot, and Dr. Scott's indelible leadership, these remarkable physicians have transformed the field of CT surgery in ways that reverberate for generations, and their legacies have paved the way for generations of Black physicians and stand as a testament to what relentless pursuit of excellence and determination in the face of overwhelming adversity can accomplish. Thank you so much for joining. I think this was Cy, for joining Cy to celebrate these amazing physicians' legacies. And Cy hopes that you were all inspired by their contributions and took something away from their stories. So that was in honor of Black History Month. What a great post. Pretty interesting. Who's with us today, Josh?
Let's find out together.
Hey, let's do
We've
it.
got Velda and Christina and Ken. Hi, Velda. Hi, Christina. Hi, Ken.
Hi. Hey, everybody.
Christina is
So
waiting in the
glad to see you.
pre-op room.
For what? What's going on? Why do I not know? You don't need to share. You'd be sharing with the world, but whatever it is, sending you best of luck and wishes and all of that good stuff.
Yeah, 100%.
Pre-op. Eek. Eek.
Molly. Hi, Molly.
Hey, Molly. I'm so cold, and every time you say her name, I just think of warmth and sunshine because she is a little ball of radiant sunshine, but I'm so cold. I just want some sun. All right, moving on to Topic Tuesday. This is going to be a big mouthful, guys, but it's such interesting information. So this is a post by another med student, Alvaro, and he was diving into transcatheter aortic valve replacement. That was the word I couldn't think of last week, transcatheter. It's a minimally invasive procedure that repairs damage to the aortic valve in your heart. See, February, as I mentioned, was Heart Valve Disease Awareness, the 22nd, specifically that day. And we focused the month on aortic valve issues, although we did talk a little bit about the other three valves. So one of the things we were talking about last week was surgical aortic valve replacement, or SAVAR. And this week, or last week, 2 weeks ago, you follow the timeline, people follow the timeline, is about TAVR, which is transcatheter aortic valve replacement. So what is it? It's a mouthful is what it is. All right, it's a minimally invasive procedure to treat aortic valve in your heart. And so you have to imagine that the aortic valve as a tunnel that allows carbs or blood to exit the heart and travel to the rest of the body. And in a healthy person, this tunnel, or your aorta, this tunnel, it's wide open, letting traffic flow smoothly. However, with aortic stenosis, the entrance of the tunnel actually becomes a little narrow and a little stiff, and much like a collapsing tunnel, it only allows a few cars at a time. So this creates a traffic jam behind the tunnel, forcing the heart, we're going back and forth with euphemisms here, I guess, forcing the heart to work harder and causes delays in delivering supplies to the city beyond. Oh my gosh, Alvaro is really, really using his imagination. So it basically reduces blood flow to the body, aortic valve stenosis, okay? And instead of shutting down and rebuilding the tunnel from scratch, like in open heart surgery, so instead of shutting down the heart and rebuilding that valve, okay, a TAVR works by inserting a fully functioning pre-made valve, or he's saying tunnel, inside the damaged one. So this new tunnel or valve will actually expand outward and pushes the collapsed part aside, and it restores normal traffic flow or normal blood flow. So as a result, the heart does not have to work with strain, blood circulation improves, and the body gets the oxygen that it needs, all without need for major surgery in this type of procedure. Okay, here we go. Here's a nice visual. We love visuals. So here is your aortic valve right here. Okay, this is a diseased valve. And coming up here starting way back, could be at the groin. I mean, honestly, you could go in through the neck. I think you can go in through the wrist, but let's assume groin because I'm not a physician and I'm just trying to remember. It goes all the way up, comes in from your femoral, goes right to the aorta, comes all the way up. Boom, here it is. That's the catheter. It's in the aorta. And here it is. Look at this. It's deploying that valve right there. And the aortic valve has now been replaced by a prosthetic valve. Okay, so what exactly does the TAVR treat? So its main use is an aortic valve replacement when it comes to aortic stenosis. And so this is, again, when there's a narrowing of your aortic valve or the area around it. And this usually happens due to age-related wear and tear. So especially if you're over age 70, most people could have stenosis. Doesn't mean you wouldn't have regurgitation. And stenosis really is it's like a buildup of calcium or a thickening of the valve. And other issues could include rheumatic heart disease, a condition that happens after an autoimmune reaction to a streptococcal infection, and that can damage the heart valve. Or you have a bicuspid aortic valve, which is an aortic condition that allows you to only have 2 flaps instead of 3, and that is congenital, meaning you would be born with that, okay? Who's a candidate for this non-invasive procedure, non-surgical, meaning open heart procedure? Number one, you want to, if you have aortic valve stenosis, you have narrowing, that would make you a potential candidate. You had a bicuspid valve. If you've had a prior valve replaced and it's starting to wear out, most patients over 65 would be a really good candidate for this because it's more, again, minimally invasive. You don't need to have your sternum sawed open, being honest, saying what it is, right? And any older patient that has underlying health concerns. So it's good for people that might not really be able to tolerate an open heart surgery due to their age or other health conditions. So what's inside of the valves that are used in a TAVR? So multiple transcatheter aortic valves are available on the market. There's a lot by a lot of different companies. However, there's only 2 currently FDA approved. The Sapien valves by Edwards Life Sciences are balloon expandable, and they're made from bovine tissue. Bovine is cow. So you're not getting a cow's valve, you're getting the tissue from the cow, which we talked about last week, and a chromium cobalt alloy frame, which was those things that look like the wires. So the self-expandable Evolute R valve by Medtronic is made from porcine tissue, which is pig, and a nitinol frame. I hope I'm pronouncing these right, because I think I'm butchering it. And they can be repositioned after deployment. So if you see in TAVR, you can't use mechanical valves, okay, like in open surgery. You are, in a TAVR, you are limited to only bioprosthetic. So bioprosthetic means they will not last the rest of your life, and nothing's guaranteed to last the rest of your life. They may last less than a mechanical, which we've talked about before, which is why they tend to go into older patients. Sounds so grim, but it's true. But you also can deploy a second and up to a third, I believe, if you needed to, if something went awry or it wore out. Mechanical, you have to do open. As of today, you have to do it open, and they say that's a one and done. But with that has its own set of circumstances, like potential ticking noise and having to be on an anticoagulant, a blood thinner. So let's talk about what happens when you have the TAVR. So since it's minimally invasive procedure, it's very small cuts. And let's talk about the steps here. So first, anesthesia will be given to prevent pain and to numb the body. They don't want you moving. They don't want you jumping, right? And then they make a small cut to insert this thin tube or a catheter. It goes into the femoral artery, which is at your upper thigh. It's kind of in the groin area a little bit. And if they need to, they can use a different entry point, which we had just talked about a few moments ago. And then they thread the catheter up to your heart using an X-ray as a guide. And if any of you have had a catheterization, you probably were somewhat awake. And they just gave you Versed, and so you might remember a little bit of the pressure when it initially goes in. But once it's in the bloodstream, like once it's in the artery, it's not, that part's not painful, and it's not going to be painful when it gets to the heart. But once they get into the heart, they're going to place the new valve inside your own older aortic valve, and it will expand. It's pretty wild. The new valve actually fits right in place, and it's going to stay there, while the old valve will stay behind the new one, and it gets pushed to the side. So we don't even cut out your old one. They just put one right over top. And then the catheter is removed and the incision is closed. Ta-da! Sounds simple, right? Well, it's relatively simple, a lot more simple than having your chest cut open. But there are risks with everything in the world. There's a risk. So there's a risk of a stroke. There could be a risk of an infection in the blood vessel or an injury, bleeding, electrical system disruption that could require you to need a pacemaker, a leak around the outer edge of the new valve, and then if certain things go wrong, you might need to have traditional surgery. So there's always that option. I don't know statistically how many people that have had a TAVR then need to have open. It can't be too high or we'd be hearing about it more often. So I'm assuming it's going to be low. But after this procedure, most people, they can leave the hospital like within a day or two. Sometimes some people stay 2 or more days. I would assume that could be pain control or blood pressure control or heart rate control or for a variety of reasons. But, I'm a big believer, don't rush it. Don't rush yourself out. If they need you to stay, they need you to stay. And so stay, right? But overall, when you have a TAVR, the recovery time, it really can vary depending upon your case and your overall health. Here's a fun fact. The first TAVR was actually performed in France in 2002 by Dr. Cribier. Cribier, maybe that's how you would say it in France. I don't know. I apologize for butchering your last name, but 2002. I mean, it seems like it's been around forever, right? It kind of feels like they've been doing this a lot longer than just 23 years, but it was only 23 years ago. So think how far we've come in like 2 decades. It's just incredible. So that's all Alvaro had for all of us. I hope you liked it. Can't wait to see what comes up, this week as we start a new month. But that was your topic Tuesday. Mouthful, right? Right. What's going on? Any chatter? Any more peeps?
Velda
Yeah.
asks, what about a mitral valve repair? Is that in the aorta?
Mitral valve is in the actual heart. Dr. Stacy Fisher, the cardiogeneticist cardiologist, went over the heart diagram with us. I will never remember which side, right or left. My guess is it's going to be the left. I'm thinking it's the left if I remember where she was touching. So you've got your mitral valve, your tricuspid, and your pulmonary. I hope I'm saying those right. There's something like that. I could be right. I'd be really excited for myself. But you have three others in addition to the aortic, and those others separate chambers, right? So your aortic valve is what's right there at the aorta. It's very different, special.
Ken says it is 6:15 a.m. here. A Category 2 cyclone is heading towards Brisbane, Australia as we speak.
Oh my goodness gracious.
4 million people are on high alert. Ken, stay safe.
Stay safe, all of you. I can't even believe you're up with us. We appreciate it. I'm surprised. Well, I appreciate it because you could lose power. So please keep us all posted on how everything goes. I know we're supposed to get some wild weather across the United States, everything from major snowstorms to tornado outbreaks in the south. And we've got wildfires. I don't even know if they're under control off the East Coast in the Carolinas right now. That's just every day is a new day with a new set of challenges for all people.
Velda says, thank you, Karen.
You're welcome. You're welcome. All right. We're moving on to a post about our collaboration with Lawrence Hope. Oh my gosh, we had so much fun at the Rock from the Heart event because Lawrence Hope was so kind and we got samples, a couple samples we were able to show people. Like Terry and I needed samples, right? We probably have like 3 or 4 bracelets ourselves. And we did, well, I actually had 2 on plus one of the samples. She had a bunch on and people were just fascinated with them. I mean, look, it is really important to consider wearing a medical bracelet or dog tag around your neck, or even having it on your keychain, whether you have an aneurysm or you've had a dissection or you've have a pacemaker even, or you've gotten a new heart valve, especially if it's mechanical. It's pretty important. It's not one of those things that you actively think about because I think people have this mindset that it then draws attention to the fact that you have a disability when really you're just less able, and it has nothing to do with these pieces of equipment. It has everything to do with making sure that if you're in a medical emergency and you can't really advocate for yourself, that an EMT who's trained to look for these products finds it, flips it over, and is able to read key critical information about you. So, what are they going to read? Your name, right? They're going to read briefly the most important key critical like conditions. They're going to read if you have any allergies to common things like IV contrast, big, latex, big, right? They're Demerol, morphine. I don't even think they use Demerol, morphine, big. They need to know these things, right? Especially anything that causes anaphylaxis. But they also want to know about your medications. Are you on a blood thinner? Right? These are important. That's an important thing to let somebody know. It's not really important to let them know you're on a beta blocker. Um, or, or something like that that's a common medication. I think it's assumption that if you have a heart condition or you have an aortic condition, that you could probably be on this, right? But blood thinner is not something everybody would be on. That's different. So you have to use a little bit of thought when you write down on the back of your tag the information you want to have there and your emergency contact. What if you're not with that person and you want them to know? Instead of wasting time rummaging through a purse or a wallet or through a car, if you were in an accident, God forbid, then they've got it. It's right on you. They can look it up. And first responders, they're really familiar with it. So when you put your terminology and your acronyms, they're going to understand what they're looking at. Um, Lawrence Hope does a great job too of working with you to find out the exact product that would work with you and your lifestyle. Are you very active? Do you want something that's silicone? Do you want something in a metal that's hypoallergenic? Do you want something that's interchangeable? Like, what do you want? You want it to look more like a Fitbit watch type band? Do you want it woven? There's so many different options. I'd find it hard to believe that somebody couldn't find something that resonated with them. And yes, fashion and all that's all great. It comes down to feeling a little bit more at ease, knowing that you've got another check mark in the I'm doing everything I can do to control this situation if I was in an emergency. And I'll tell you that Lawrence Hope always has some kind of discount going on. Always, always, always. So this isn't about providing you with a code. This is about providing you with a link that will take you seamlessly to a page where we are, in full transparency, compensated. A small little donation is kicked back to us based off of your purchase with no additional charge to you. But this is their way of thanking us because we're so in love with them as an organization and their products. I truly am a very big believer in that particular product, as one way of letting people know if you have a medical condition, what that is and how they can best treat you. So you will find that underneath of our Hope Shop. There's a link. You'll see this picture. Click on it. Click on the link right in there and shop away. Shop away and enjoy that. So that was a post on our Friday. Yeah. All right, we're moving on to Survivor Series Replay Saturday. Hey, this is all about Jack Crow. Do you guys know who Jack Crow is? Jack Crow's been an aortic dissection survivor since January of 2021. He dissected when he was 60 years old in the wilderness near his cabin in Upper Peninsula of Michigan. Okay. He had emergency surgery several days later in rural northern Wisconsin to replace his ascending aorta. And he had follow up open heart surgery 6 months later at the Cleveland Clinic to then repair his arch, actually replace the arch. Prior to his dissection, though, he worked as an executive director at Year Up Chicago. It's a workforce development not for profit organization. And he was also the founder of Cristo Rey Jesuit High School and Christ the King Jesuit College Prep, where students from low income neighborhoods work at large corporations to earn their tuition. Great idea, great organization. But before his nonprofit career, he was a partner in Winston and Strawn, which was a large law firm in Chicago. Pre-dissection, Jack was an Ironman triathlete. Pre-dissection, he was a marathon runner and an endurance cyclist. Okay, he was very active. And post-dissection, though, amazingly enough, he continues to actively bike ride. He jogs, he open water swims. He also participated in the aortic dissection survey and research study that was conducted by Dr. Prakash out of UT Houston. For 30 years, he's been married to his wife, Ave Zuccarino, and they have two adult children. And in early 2023, he helped to start a new Facebook page, which is called Aortic Athletes. And that page is really dedicated to all of you who want to remain extremely athletic and to stay a very, living a very exercise focused life. And that's wonderful. And when I first came into this community, I thought that is so not achievable because I was scared and I didn't understand. But if you work with your physician and you tell him, this is who I was before, this is who I have to be afterwards, your physician should work with you to create that plan, to monitor you, to make sure your heart rate is responding and your blood pressure is responding, and allow you to live that life that you want to continue living. And that's what he's done. And his page actually focuses on providing medical posts and information that's been actually shared with our community through our YouTube channel, and him and Carmen David interviewing physicians that focus their life around how to live your very best athletic life with aortic disease, whether it's a dissection or not. I think initially everybody focused on dissections, but you know what? We've got this huge watch and wait community. Like, what are they doing? Once they find out they have an aneurysm, they're scared to move, a lot of them. And what we're learning is they don't need to be scared to move. So if you are an exercise junkie, if you are an exercise fanatic, if you're someone who just loves being healthy and treating your body the best way you can, and it includes a lot of exercise, check out Aortic Athletes. And we actually have an upcoming event with them on the 5th, I think, right? 5th or 7th. I don't know what day it is. I'm very confused.
Yeah,
Josh will have to help me out.
it'll be
What?
on the 5th at noon Eastern.
That's right. Thank you so much. And that is in our events page. So check it out. He interviews other triathletes, marathon people, Spartan race people, exercise endurance people. I don't know what to call them, but they're all so amazing. He interviews them and what it's like doing this post bicuspid valve replacement, dissection, watch and wait diagnosis. And then he also interviews physicians right here on AHTV, our YouTube channel. So please check that out. But again, you can click on the link in this post to check out Jack's story as he tells it, as only he can. And if you have not considered being a featured on our Survivor series, I highly encourage you to think about that, because we want you to be that shining star in someone's life. We want you to share your story from the patient perspective, the survivor perspective, the caregiver perspective, the person who might be grieving the loss of someone. And this is because sharing our shared stories, I don't know if that sentence made sense, but you know what I'm saying. Sharing our best practices, sharing our experiences, really is validating for those that are listening to it and receiving it. We hear a lot of similarities and it just makes us feel good. It's just a thing that happens. And I think for the person sharing, it can be very therapeutic just to kind of like get it out, right? Or it's very empowering and they love sharing their story. There is no such thing as good, bad, indifferent. It's their story. And it is such a blip in your overall life. It might have made a massive change, but your life is bigger than this one story, but it is so impactful to many other people. So we would love for you to have this opportunity and make that kind of an impact. And you can do it one of three ways. You can submit your story in written form, you can do a pre-recorded video, or you can go live like I'm going with all of you, taking questions, listening to chatter that's going on in the channel, which is always the most fun way, I kind of think. But if you're interested, there is a link. You could fill that out. You can go under programs on our website and you can complete the form, and someone will be in touch with you soon to get you featured on our Survivor series.
Excellent.
Okay.
Molly
Thank you.
says the mitral valve is located in the heart between the left atrium and ventricle. My cousin, ironically, just now, 5 minutes ago, got out of that very surgery. She's doing well. Excellent.
That's great. Very good. Yeah, it's so common to have your mitral valve worked on. So common. I mean, before I was even part of this community, it's like just one of those things like it's Tuesday, going to do a mitral valve repair. Like, I mean, Cleveland does the highest quantity evidently in the country, in the United States. It's just so common. It's like, got to do a mitral valve. I'm going to do 4 of them today, that kind of thing. But to the patient, it's like, life changing. And it will be. From what I hear, even my cousin had her aortic valve replaced, going in a little winded, a little fatigued, coming out completely changed, ready to hit the pavement, and go. And that's amazing to me. to feel that kind of difference. And I was right. It was the left side of the heart. I can't believe it. I don't know where I retain this information. It's great. All right, we're moving on. Hey, this is why I didn't even realize that this got posted this past week. I've just seen so many donations coming in for the aortic disease awareness car magnet or fridge magnet or wherever you want to place it magnet. You can even get some and slap it on the back of an ambulance. They'd be so excited to see it, they wouldn't even take it off. This is the aortic disease awareness ribbon, and $10 donation, you can get one today. And it's a great way to start a conversation about what is this magnet? What is this logo? What does this mean? And you're just basically having a grand opportunity to educate people about aortic disease and how prevalent it is in families, and how, while dissections are rare, aortic disease is much more common than you think. That's why we need people to think aorta, right? Goes back to the same thing. So there's a link here on the post, or you can also go to our Hope Shops, and there's a link there, and you can order one today. And then send a check or make a donation via PayPal or Venmo or Clover. Three different ways to do that. So I have been filling those all morning. Envelope. It's been great. It's been a lot of fun. Hey guys, just came out of Rock from the Heart. So much fun. There's another event happening. Where's all my South Carolina people that are not near fires? God, I hope you're not. Like, just going through fires again, it just makes me shudder. Where's everybody? This is in Charleston. This is in Charleston, South Carolina. There is a band that my friend, who's an interventional radiologist, is part of. It's called As If. So 90s, right? It's a 90s band, and they are hosting a benefit concert for Aortic Hope at the Palmetto Brewing Company right there in Charleston. Evidently, it's a stop off of the trolley line. There's no cover charge. It's from 3 to 7. We're going to be doing 50-50. So raffles, we're going to be there. We're going to have our brochures. We're going to have some giveaways, which is going to be a great fun time. Hopefully the weather's amazing and we can be outside, and it'll be wonderful to be out there with great music, dancing, drinking, eating from the food trucks. And anytime you purchase a drink, alcoholic or non-alcoholic, Palmetto Brewing Company is using this as a pint night, and they're donating $1 back over the whole 4 hours back to Aortic Hope. So this is great. It's a great way really for patients and caregivers to meet each other. We have a new Hope Ambassador we will be announcing in the next coming days, and she lives in that area and she's going to be helping us. So she would love to meet all of you. So please consider coming out and hanging out with all of us in Charleston, South Carolina. We have so many wonderful events that are coming up. So As If is actually a premier Charleston 90s through the 2000s alternative rock band. And they'd love for you to be there as well and check them out. They do a great job. I've seen videos, I've listened, and I know the person in the band, and he sounds fabulous. So you should come out and hang out with us.
That's very, very cool.
So exciting.
Yeah.
And then we've got another one coming up in Maryland. They're popping up all over the country.
Nice.
I love it. So fun.
Molly shares with us, apparently the mitral valve goes from 0 symptoms to full-on symptoms, like overnight. That happened to my cousin, fine, and then not. The aortic valve is a steady decline generally.
I wonder what the other two are like. I wonder. But evidently, I think what Dr. Fisher said is you can repair them endovascularly, the mitral also, what I hear. I don't know. I don't remember. I'd have to watch the whole video.
I'm pretty sure that's what she said. She said that it wasn't, the Widowmaker wasn't so much a Widowmaker these days, but still classically known as the Widowmaker.
Yeah. Interesting. Okay, we're moving on. Let's share with you some more of our events that are happening now that I have everything pretty much up for March except for one. So we do have our Spanish speaking support group, you guys. We have this. It's here, and we're staying here. Just need people to notify people who would prefer to converse in Spanish that you can join the support group meeting. I know we're just starting to get the word out with a lot of physicians who have a heavy, thank you. Oh, my brain. I couldn't get off of heavenly, have a heavily populated Spanish speaking practice. So they are going to start learning about this. So that is tonight, as is our a caregiver support group meeting at 10 p.m. That is happening tonight. So you have to be a caregiver. Totally different links to join, which is why it's important you click on these events. All you have to do is register to the preferred support group once, and then you're notified when these meetings happen via email. And all of the meetings happen via Microsoft Teams in a closed environment. We also have tomorrow, Tuesday, first Tuesday in the month, Aortic Hope, Aortic Bridge, which is a grassroots support group that's located out of Brooklyn, New York, based from Maimonides Medical Center, led by Dr. Ben Udelman. We came together many years ago, and the name has just basically stuck. It was pre-COVID, but that's our daytime, 12 o'clock Eastern. All times are Eastern. 12 o'clock support group meeting that's happening tomorrow. On the 5th, on Wednesday, we do have that live event with Jack Crow and Aortic Athletes happening with. Yeah, I can't wait to hear this because I'm not sure how to pronounce this name. So I'm excited. And you know how long it took me?
Turns.
Tor, Torbjorn?
That's what I was going to say.
Okay, well, maybe we're right. We should do a pronunciation. You know how hard it was for me to find that O with the slash mark through it?
I was very like, wow, somebody found that.
I did not. He had it in his email, so I just copied that letter.
Oh, well done.
Put it in there. I read the directions and still couldn't make it happen. All right. And then we have Canadian support group. Shout out to Velda and Martha and everybody over there. Therapeutic Thursday this week. We may have a special guest. Stay tuned. I'm looking to confirm that. And we will soon be adding in a link. So if any of you would like to be a guest on the Therapeutic Thursdays, you can now do so by completing a link that will be put up there, hopefully within the next 12 hours on the post. And just note, this is not a therapy session. We're not doing therapy. We want to hear from people who want to share what living life with AD or with your partner with AD has been like for you from a mental health, emotional perspective. That's what we want to know about. We want to talk about it. You're going to talk about it with John. And we're going to just validate it because trust me, you're not the only one who's had these feelings. You're far from the only one. And so it should be really engaging to hear what other people go through and then talk about it and let John form his thought of the day about this. And if you're not familiar with John Quick, he is a survivor of an aortic dissection. He will tell you all about himself every Thursday. And then he became a therapist. So it's so great. It's great to have somebody like that. It's our second person in the group like that. So yeah, I'm actually going to be featured on the 27th of March, which I haven't put myself up there yet. So it'll be interesting to share stuff. You know, it's crazy. Oh my God. Last night, I don't know what happened. I don't know if it was a dream. Something happened. And I was so startled with such intense dizziness in the dream that I remember like flipping backwards and gasping for air. And I woke myself up half groggy and did not feel well, like in my chest, nothing felt right. And this is what I do. I might like, have my eyes closed. I'm like, could I be possibly having a dissection in my little bit of natural tissue? Like, does it feel like it? I go in, I do a systems check. I'm like, well, how should I wake my husband? Do I have to get out of bed? Can I throw something maybe against the wall? I'm in a different bedroom because he snores. Just, hey, I'm being honest. That's what happened. But I'm going through the whole thing. Like, do I really want to have to like get myself dressed and call an ambulance? So by the time I'm done going through everything, I fall back to sleep. And I can't tell you how many times this happens to me in a week. And I don't know what to do about it. I mean, I could go back in for some EMDR. I probably need a tune-up. I don't know why it's happening. I don't know. Other than I have some other pain things going on in my body, non-aortic related. And I think it manifests itself at nighttime. It must. But it was horrible. So, oh yeah, I can't wait. Let's talk about it. That's going to be fun. And so that's what's happening within this week. But we do have coming up an aortic artist. It's coming up next week. I don't know what we're doing yet. That's why it's in black, because she hasn't told me. It's not like it's a secret. Just tell me what we're going to be painting. We have a grief support group meeting. We have our Ask a Doctor coming up this month. That's so fun. That's going to be on the 18th. So he is going to be live answering written questions on our Facebook page. And Terry and I are going to be here relaying those to you and typing to him the questions you give us here on YouTube. So it's a simulcast. I think it's so fun. So that's happening on the 18th. And then we have our live Q&A with Dr. Pedro Caterino. He is cardiothoracic surgeon out of Cedar-Sinai in California. So that is happening on the 25th at 7 p.m. So excited about that as well. And that's pretty much all the things that are like out of the ordinary that we normally have going on. I've been loving watching Qigong and checking out Kevin's stuff. He's it's so nice to be where he is in Florida, and I can hear nature in the background, and he's breathing and he's moving, and yeah. So you guys need to check this stuff out. It's all free community events that are happening. Although we always appreciate a donation to help us offset, what we're able to provide here for you. But you guys should check it out. Yeah, that's our events. That's what we got going on. That's it. That's all I got, everybody.
As we closed out Qigong, he comes in from outside. He's like, "Oh my God, it's so hot already."
Yeah. Okay. He can come here and visit. It's like a high of what, 22 today, 25 or so, maybe it's 30. I don't know. It's cold.
Yeah. We've got that fall spring again.
I don't like it. But I was in Delaware this weekend and it was like 65 and sunny. So pretty. It was something nice about I like seeing the ocean. It makes me very happy. I don't go in it, but I do like looking at it. And it was very pretty. Well, I just want to take a minute. Unless there's any comments. Anybody have any comments? Anything you want to say?
Molly shares she is having robotic mitral surgery.
Who's having that? Christina?
And
Molly?
Velda says, thank you, Karen and Josh. I think she's still referring to her cousin.
Oh, her cousin. I'm confused. Oh, you guys are so welcome. I think we need to do a giveaway. I think we're going to do that giveaway. I'm preparing you now. There's going to be a giveaway next week. I'm just letting you know. Be ready for it. So you need to come on and you need to interact. So you're going to need to make a comment. You're going to need to participate. And I think next week we're going to give away a $25 Lawrence Hope gift certificate or a gift certificate to our Hope Shop. And I'm making myself a note right now so I do not forget. I just did. For next week. Okay? That's what we're going to do. And then wait until the 17th for St. Patty's Day. We'll do a contest then. We will. I was just going to say for anybody who wears green, but I can't see you, so never mind. But we'll do one on St. Patty's Day anyway.
Right on.
So silly of me, right? All right, guys, before I go, don't forget, please click like, please click subscribe, click the bell so you're notified every time we go live, and click share, because I know that people are going to find the information about transcatheter aortic replacement interesting. There's a lot of stuff to pay attention to. So other people that have health conditions could use a Lawrence Hope medical ID, bracelet, jewelry, dog tag, what have you. So click share. It'll be interesting to see who really garners a lot out of last week's information.
And Ken, stay safe.
Yeah, please, Ken, stay safe. Keep us posted. Let us know how everybody fares over there near Brisbane. All right, guys, have a great night. We'll talk to you soon. Take care. Bye-bye.